Pregnancy for most of the women is considered a special experience. They feel that a baby is growing in them. They feel a special feeling of motherhood. So in every way they feel that they are special during that time. But it is not so for every woman. There are many women who are hesitant of becoming pregnant once they have a complication in their last delivery. So this hesitancy for the next pregnancy can be due to the complications they have had during their last pregnancy. When a pregnancy has complications associated with it, that is when we call it a high-risk pregnancy. Now, when we speak about complications in pregnancy, the most commonly encountered is the hypertension. Hypertension, there is no need to stress on it because most of the women are aware about the hypertension, increased BP. When they come for the first checkup itself, they keep asking, "Madam, do we have high BP? Is the BP normal? We are having headache. Is it because of BP?" So that means to say the women are very much aware about the hypertension. But what I would like to stress is hypertension, if left uncontrolled, can cause kidney damage, they can cause seizures in the mother, and so also complications for the baby. Now, what are the other complications that we usually come across during pregnancy? The other most common is the diabetes. Diabetes is a commonly encountered complication and it has to be checked on and off. The other complications are anemia in pregnancy, cardiac disease which the patient already has, or the history of epilepsy which they usually have, or it can be a twin pregnancy, or it can even be a heart disease complicating pregnancy. In today's modern obstetric practice, ultrasound examination goes hand in hand with the routine checkups. Once a woman knows that she is pregnant, in her first checkup itself, a routine ultrasound is a must. Now, this routine ultrasound we do to know whether the pregnancy is in the right place inside the uterus or outside the uterus. So also we know about the growing of the fetus also. Along with the ultrasound, we also do the routine blood test, and it is through these blood tests that we come to know whether the patient has anemia or any other blood infections or any other medical illnesses related with the patient. And let me tell you that whatever illness that the patient has, let not the doctor alone diagnose. If the patient has history of epilepsy or a cardiac disease, there are many mothers who don't reveal it to the gynecologist. So probably because they are scared that the baby will be harmed by taking the tablets, and what they do is they just stop the treatment which they were taking before. So I would advise you not to do this, but to reveal it to the doctor or to the consultant they have been consulting, because medicines, there are many medicines which are safe in pregnancy, and these illnesses can be treated either with a change in medicine or with a change in dose of the medicine. Ultrasonographic examination at the 3rd month, then we take at the 5th month, then we take at the 8th month, and also as a patient is nearing delivery. Now, many mothers keep asking me, Madam, previously you were never taking all these scans. You have delivered us even without all these scans. Yes, I agree. About 15 years back, I was not doing all these scans. But why should we risk a patient by not using these modern changes? Because ultrasound definitely helps us in knowing the growth of the baby. You can know the fluid around the baby. You can know whether the baby is growing normally, whether the weight of the baby is normal, and so also you can know whether the blood supply to the placenta and the baby is also normal. So all these we take into consideration when we look at the pregnancy. Along with the routine blood test, now there are special screening tests done during pregnancy. They are usually done at the 3rd month, that is at 12 weeks of pregnancy. Now this blood screening test is done and it is correlated along with the scan, and through these blood tests we can detect certain congenital chromosomal anomalies for the babies, which is very important to know. Because I have seen mothers coming with children who are mentally retarded, what you called as Mongol babies. The babies, I have delivered them about 20 years back. Today when I see the mother coming with a child, an abnormal child, I feel guilty thinking, no, I could have avoided this if I had done the test. So today, probably they are costly tests, but that does not mean that though these tests are costly, but now routinely we do it for every patient. For those who are not affording, if they tell, we can make arrangements in the hospital so that it can be done at a lesser rate. But I think these tests are very important during pregnancy to avoid such long-term complications. Most of these complications during pregnancy, if detected early, can be treated, and most of these complications can be avoided. Because once there is a complication during pregnancy, that will go on to a complicated delivery, and that will be a threat to the mother and the baby. So I think that trying to avoid these complications can create a safe and a pleasant journey during pregnancy. Now, once a patient knows that there are complications, if these complications are detected during pregnancy, it should be made a point to consult a consultant in a hospital where all the facilities are available. It has to be a hospital where all the specialists like neonatologist, neurologist, physician, and all other facilities are available so that the delivery can be a safe one.
ആതുര ശുശ്രൂഷയുടെ 30 വർഷങ്ങൾ.
കിംസ് അൽ ഷിഫ സൂപ്പർ സ്പെഷ്യാലിറ്റി ഹോസ്പിറ്റൽ, പെരിന്തൽമണ്ണ.